China's Bone-02 bone glue, a medical breakthrough that can change surgery forever. China has just developed a groundbreaking medical innovation, and it could change how broken bones are repaired forever. Introducing Bone-02, the world's first bio-adhesive bone glue that works even in a blood-wet environment. Visual: surgeon applying glue on bone animation, developed by Dr. Lin Xianfeng's team at Sir Run Shah Hospital, Zhejiang University. This new material can bond broken bones in just 2 to 3 minutes, even during surgery where blood and fluids are present. Visual: clock timer 3 minutes plus animation of bones joining together. This adhesive is bio-absorbable, meaning it dissolves naturally as the bone heals, so patients may no longer need a second surgery to remove metal plates or screws. Visual: metal implants dissolve gives healthy bone healing. Clinical trials in China have already treated over 150 patients with promising results. The glue can withstand over 400 pounds of bonding strength, with compressive strength around 10 MPa, strong enough for real-world fracture fixation. Visual: strong bone graphic, 400-pound strength text effect. Inspired by nature, researchers studied how oysters stick firmly underwater and applied the same principle to human bone repair. This discovery allows for minimally invasive surgery, smaller cuts, faster recovery, and less pain for patients. Visual: oyster on rock gives transition to surgical scene, but remember, bonding in 3 minutes doesn't mean bones heal in 3 minutes. Biological healing still takes weeks to months, with normal bone regeneration, callus formation, and remodeling. Visual: timeline animation showing inflammation gives repair gives remodeling. Bone-02 is still under clinical research in China. Experts say full approval could come around 2026 to 2027 before global release. In countries like Pakistan, it will need local approval by the Drug Regulatory Authority (DRAP) before being used in hospitals. Visual: world map zooming from China to Pakistan. For medical and nursing students, Bone-02 is a perfect example of how anatomy, physiology, and biomaterials meet modern technology. It may one day replace screws and plates in many fracture cases, leading to faster recovery and less invasive care. Visual: students and lab plus hospital teamwork animation. Bone-02, the 3-minute bone glue that could transform orthopedic surgery forever. Innovation today, healing tomorrow.
Implications for your studies: anatomy, physiology/nursing, fractures, bone. Given your background anatomy, physiology, nursing, patient-centered care, here's how you can integrate this into your perspective. Anatomy of fractures, fixation. Use Bone-02 as a case study. Compare conventional internal fixation plates, screws with adhesive fixation. Document the anatomical challenges of fragment reduction, fixation stability, anatomy of bone healing. Inflammation gives repair gives remodeling. Physiology, healing. Explore how fixation stability influences micromotion at fracture site, osteoblast to osteoclast kinetics, vascular and growth, callus formation. Ask: does rapid adhesive fixation allow earlier loading immobilization? Does it change the biology of healing? For example, less stress shielding versus metal hardware. Nursing and patient-centered care. For a patient treated with adhesive fixation, what are the nursing priorities? For example, monitor for surgical site complications, infection, hematoma, but perhaps fewer hardware-related complications, loosening, removal surgery. Early mobilization possibilities. Discuss how rehab plans may differ versus traditional fixation. Patient education. Managing expectations. Fixation is fast, but biological healing still takes weeks, months. Consider access and ethics. In your country context, Pakistan, what barriers exist? Cost, device availability, surgeon training. How do you communicate to patients? Research. Critical appraisal. Evaluate the evidence. Ask what the trial design is. Are CT versus observational? What outcomes measured? Healing time, function, complications. What follow-up duration? What fracture types included? You might propose: if I were designing a study of Bone-02 in Pakistan, how would I set it up? Interprofessional collaboration. This innovation touches orthopedics, biomaterials, science, nursing, rehab, patient education. Think how you as a nurse, a medical professional would liaise with surgeon, physiotherapist, patient, family to deliver optimal care. Reports, for example, China MedTech Radar suggests submission to China's regulatory agency National Medical Products Administration (NMPA) may occur in 2026, with approval possibly 1 to 2 years later. For Pakistan or other countries, device approval will require local regulatory review, possibly via the Drug Regulatory Authority of Pakistan (DRAP) or equivalent. So adoption here may lag. For you specifically, keep monitoring orthopedic biomaterials in Pakistan, Asia. Check if there are partnerships licensing with Chinese institutions. Check if local surgeons are aware, willing to trial the adhesive. Cost may be higher initially. Meanwhile, even if Bone-02 is not yet clinically available in Pakistan, the concept is still highly relevant for your studies. Biomaterials in orthopedics is a rising field. You might find local research or cheaper alternatives. Thank you for watching. Like, subscribe, not forget.